Hi everyone, we are the Group 1 and we are here to present the mental health issues affecting the elderly population. And the Group 1 are Mary Carmel, Maria Venet, Elale, Sherry Mar, Mary Joan, and Lem Lem. So introduction. Aging is rapidly increasing in Canada and worldwide. In 2015 and 2050, the proportion of the world's population over 60 years of age will nearly double, which is an expected increase from 900 million to 2 billion people. About 15% of older adult population suffer from a mental disorder, and older adults, which are 60 years old and above, are at high risk of developing mental disorder, neurological disorder, and substance abuse, and sometimes they do experience this simultaneously. Hello, my name is Joan, and I'll be presenting dementia, which is the most common mental disorder affecting the older adults, and it is estimated that 47.5 million people around the globe are currently living with dementia, and it is anticipated to increase to 135.5 million in 2050. Dementia is a set of symptoms that is caused by the damage of the brain cells, and different types of dementia are associated with particular areas of the particular type of brain cell damage in particular regions of the brain. So dementia affects the memory, thinking, problem-solving abilities, and activities of daily living. There are also non-cognitive and behavioral and psychological symptoms like agitation, sleep disturbance, elation, and hallucination. And in Canada, it is stated in Alzheimer's Society of Canada that there's 564 million Canadians living with dementia. So the symptoms of dementia can be classified in 7 A's. First A is amnesia, inability to recall recent events. Aphasia, loss of ability to express or understand spoken and written language, and there is agnosia, inability to recognize own face, and apraxia, there's loss of ability to initiate purposeful movement, and then there's altered perception, which is the misinterpretation of sensory information, and there's also apathy, which is the loss of drive or initiative, and there's anosognosia, which is the loss of ability to realize that there is a problem. Age and genetics are the risk factors for dementia that we cannot change. However, there are some active areas of research in risk reduction and prevention that could help us decrease the risk of developing dementia, like cardiovascular risk factors. If we protect our brain, that it could help us decrease the risk of developing dementia in the future, like not smoking and eating healthy, and keeping your blood sugar or blood pressure under control. And also there's physical exercise, because evidence suggests that exercise may directly benefit brain cells by increasing blood and oxygen flow to the brain. And also there's diet. It is shown that little red meat on the diet and emphasizing on fruits and vegetables actually help protect the brain. Second part is Alzheimer's disease, which is the most common cause of dementia, which accounts to 60 to 80% of dementia cases. It is a chronic, progressive, degenerative disorder of the brain, and age is the greatest factor because majority of the patients are over 65 years old. Alzheimer's disease is the destruction and death of nerve cells that causes memory failure, personality changes, problems carrying out daily activities, and other symptoms of Alzheimer's disease. Having a family member, like a sibling or a parent, with Alzheimer increases the individual's risk for developing Alzheimer. Symptoms for Alzheimer's are really hard to predict, or the order in which they will appear or the speed of their progression, but the following are some of the changes you may expect as the disease progresses, according to Alzheimer's Society of Canada. Cognitive and functional abilities, a person's ability to understand, think, and remember to communicate. This could impact a person's ability to make decisions, perform simple tasks, or follow a conversation. And also there is emotions and moods. A person may appear apathetic and lose interest in favorite hobbies, and some people may become less expressive. And also there is the behavior, which is a person may have reactions that seem out of character. And then there's physical abilities that disease physical abilities, the disease can affect a person's coordination and mobility to the point that it affects their activities of daily living. Some of the modifiable risk factors I just want to mention, like type 2 diabetes, stroke, hyperlipidemia, hypertension, obesity, chronic inflammation like arthritis. We can reduce the risk by having healthy lifestyle choices, regular exercises, healthy balanced diet, not smoking, and stress management. And also we can maintain healthy weight as well in addition to that. And also another risk factor is inadequate intellectual stimulation. So since there's that on the brain cells, it is important to keep those brain cells active. With Alzheimer's disease, so just to let you know that there's no single test that shows a person has Alzheimer's. However, a doctor can always determine if a person has dementia, but it may be difficult to determine the exact cause. So diagnosing Alzheimer's requires a careful medical evaluation that includes a thorough medical history, mental status, mood testing, physical and neurological exam, and tests like blood work and brain imaging like CT scan or MRI to rule out other causes of dementia-like symptoms. And the most popular test to assess cognitive functioning is the Mini-Mental State Examination. However, this doesn't diagnose dementia, but it also monitors changes over time. Also, there's no cure for Alzheimer's and dementia. There are treatments available, though, that can improve the quality of life of the patients. However, it cannot stop the progress of the disease. Sample medication is cholinesterase inhibitor, which improve the memory cognition of the patient. The next to present is Salale, and she will be discussing delirium.
Hello, my name is Alahe Mahmoudian. I'm going to explain delirium among elderlies. Delirium is an acute disorder of attention and cognition, seen relatively commonly in people aged 65 years or older. The prevalence is estimated to be between 11 and 42% for elderly patients on medical wards. The prevalence is also high in nursing homes and long-term care facilities. The consequences of delirium could be significant, such as an increase in mortality in the hospital, long-term cognitive decline, loss of autonomy, and increased risk to be institutionalized. Clinically, delirium can be divided into the following three categories. Hyperactive delirium, 30%. Patients are agitated and hyper-alert with repetitive behaviors, wandering, hallucinations, and aggression. Hypoactive delirium, 25%. Patients are quiet and withdrawn. Mixed delirium, fluctuating patterns seen in 45% of cases. Criteria for delirium include: A. Disturbance in attention, reduced ability to direct, focus, sustain, and shift attention and awareness, reduced orientation to the environment. B. Disturbance develops over a short period of time, usually hours to a few days, represents a change from baseline attention and awareness, and tends to fluctuate in severity during the course of a day. C. An additional disturbance in cognition, memory deficit, disorientation, language or perception. D. The disturbance in criteria A and C are not better explained by a pre-existing, established, or evolving neurocognitive disorder and do not occur in the context of a severely reduced level of arousal. There is evidence from the history, physical examination, or laboratory findings that the disturbance is a direct physiological consequence of another medical condition. Substance intoxications or withdrawal or exposure to a toxin, or is due to multiple etiologies. Common risk factors for delirium include age, male, mild cognitive impairment, dementia, Parkinson's disease presents in 50% of patients, hearing impairment and visual impairment, malnutrition, dehydration, and low albumin. Multiple comorbidities include renal and hepatic disease, history of CVA, history of falls and poor morbidities, and history of prior delirium. There are three instruments for recognizing patients with delirium: the mini mental state examination, confusion assessment method, and delirium rating scale. Prevention can be divided into primary, secondary, and tertiary prevention. Primary prevention strategies are aimed at reducing the incidence of delirium. Secondary prevention requires optimal clinical management at the time of delirium. And tertiary prevention strategies require identification of previous episodes of delirium by taking a careful history to recognize high-risk individuals. And how to manage delirium. Treatment of delirium should focus on identifying and managing the causative medical conditions, providing supportive care, and preventing and treating complications. Thank you.
And classmate, my name is Lamlam Zagaye. I'm going to present about depression among the older adults. General fact about depression: it is a psychological condition cause feeling of sad or lack of interest. It is one of the most, but not the major, disorder among the older adults. The prevalence is high in the hospital setting and in the long-term care facility. It may not rise from the increasing age, but it's loss of health and functioning. Depressed feeling in older adult is not acknowledged because many people ignore the symptoms by thinking that depression is the predictable sign of aging. Older adult women are more likely affected than men. Symptoms including depression in older adults is depressed mood like hopelessness, sadness, empathy, irritable, apathy, that is no interest in activity, social withdrawal, hallucination, confusion, memory loss, weight loss or gain, sleeplessness, and physical symptoms like agitation and gastrointestinal malfunction. Some of the risk factors that cause depression in older adults are medical problems like major surgery, like heart attack, stroke, hearing or vision loss, a certain medication, not having social network and being isolated, living alone, griefs and loss of independence, being depressed in past or family history, drinking too much alcohol or drug abusing, trouble developing close relationship or having low self-esteem. Treatment for depression depression is treated with psychological intervention like physical activity and socialization. Psychosocial intervention like physical activity and socialization, or psychotherapy like cognitive behavioral therapy, focus on the person's mood and behavior, and interpersonal therapy like exploration and behavioral change techniques. And as well, it treats by medication like antidepressant medication. Nursing intervention. It is very important to support the major in the patient, in the client in this problem. In this case, so interact with the client in the low and firm tone, and encourage the client to verbalize his or her feeling. Be calm and support when the client shows irritable. Identify the client interest and prevent suicide and complication by helping the client feel that life is worth living. In general, this is what depression in the old